Hi, my name is Jana McGuire, and I am in my third year at Nebraska Methodist College, and this is my final presentation on gender bias in healthcare leadership. I am currently the Director of Practice Operations for Methodist Physicians Clinic and have been there for 19 years. The clinic is an affiliate of Nebraska Methodist Health System, and I report directly to the Vice President and COO of the clinics. I originally chose this topic because I truly didn't believe that gender bias in healthcare leadership existed. I had never felt that this was an issue for me. I received regular promotions and truly felt that the leadership of the clinics had high regards for the female leaders. In fact, Josie Abood had recently been named the president and CEO of Methodist Hospital, and I thought that was really exciting. I also wanted the opportunity to interview my former boss, who believes the exact opposite of me. She truly believes that gender inequality is alive and well in healthcare. However, in the middle of this project, events at my clinic really began to make me question my beliefs. There were multiple promotions given, mostly to men, and over women who had equal, if not more, education and experience than the men. So I really decided to dig into the facts and see what was going on out there. And I found that women represent 75% of the entire healthcare workforce, and that was not surprising. And I think anyone that works in healthcare would not be surprised by that. We are surrounded by women. What was surprising was that women only hold 11% of all executive level positions. And of all the hospitals in the United States, only 1/4 of those have a female CEO. In addition, there were reports that showed that men that had the same education and experience level as women made 20% more than those women did. I also couldn't find that there were any plans in place to do anything about this. There was no current legislation. There was no current groups that really were working hard to make any changes with this. And so I really then was interested in my interview because I wanted to hear what she had to think and what she thought was needed to be done for the future of healthcare. Lori O'Byrne was who I interviewed. She is currently the Administration of Population Health and Patient Experience for Methodist Physicians Clinic, and she has been in healthcare since 1981. Lori had a lot of reasons why she felt gender bias still existed in healthcare. She cites a lack of women representation in the positions due to basically a leftover mindset that men make better leaders than women, that women are too emotional and put too much emphasis on relationships than they do on making money. And there's a failure to include women in succession planning. So when there's retirements or people leave for other health systems, there's really no plan or mentoring program to promote women into these higher positions. And she really feels that women are afraid to take risks. They're afraid to apply for these positions. They're afraid to be humiliated or shown that they are not worthy of these positions. In really all of my findings, I truly believe that disparities in actually exist in all aspects of healthcare, not just in the executive leadership, but in their in research, in the schools, in the pharmacies, in a lot of areas. There seem to be an issue of gender bias. Barriers continue to exist for women to get to those upper ranks. There is a lack of women executive training programs, mentor programs, and really there is a failure of human resource departments and legislation to put a focus on gender diversity. So what's the future? Obviously, there needs to be legislation in place. There needs to be plans for promoting women to these higher levels. But women really need to be in the forefront of that. Women need to continue fighting for equal representation and for equal pay. Women need to be prepared and willing to take charge and prove their worth. I really feel like it is the responsibility of the younger women, those women that are still in college, that are just now entering the workforce. It is up to them to be brave, to fight for what they believe in, to prove that you can be emotional and care about people and want to take care of people, but also focus on the bottom line. As Lori was quoted as saying, we have not kicked the door down yet because we're afraid to, and it is up to us to make these changes.